Oakland Family Services is pleased to be providing home and community-based services in person again. But we want to make sure that you, your family, and our staff are safe. This video will explain how we can work together to keep each other safe, what our staff are doing to keep you, your family, and themselves safe, and what will be expected of you on the day of and during your home or community-based service. Let's start with what our staff are doing.
Each day, our staff complete a health attestation before they see clients in the home, community, or office. This attestation asks questions about their health and also asks them to report their temperature as taken that day. If any of their responses indicate they have symptoms consistent with or risk factors for COVID-19, they are told to stay home and seek medical consultation. When your provider indicates they are absent of symptoms, they are permitted to perform work duties in both the home and community. Our staff are strictly following the Centers for Disease Control and Prevention and state-recommended practice of social distancing by wearing face coverings and staying at least 6 feet apart from other staff and clients at all times. They are also engaging in frequent hand washing and will use hand sanitizer before and after each home, community, or office-based service. Your service provider may be bringing minimal items into your home to assist with the visit, which they will sanitize before and after each visit. We ask that you take the same safety measures to protect yourself and our staff. To begin with, on the morning of the day you have a home or community-based service scheduled, we need you and everyone who will be present in the home at the time of a home visit or who will be coming along to a community-based service to complete an online electronic health attestation ahead of the appointment time. You will be provided a link you can use on your smartphone. It's easy to do and takes just a minute for each person. The attestation will require you to take and report your temperature as of that day. Your service provider will keep the appointment if the attestations are clear of any symptoms or risk factors of COVID-19, but will contact and reschedule with you if they are not. When our staff are in your home, our expectation, in line with state and CDC guidelines, is that you and anyone else in the room with them aged 2 years and up wear a face covering and all maintain 6 feet of distance from them at all times, as will they from you. If for some reason it is not possible to maintain 6 feet of distance within your home, you and your service provider can discuss other safe alternative meeting options. If you or anyone who is part of the meeting or within proximity to the meeting is not wearing a face covering, your service provider will request that you and/or they do. If this request is met with an inability to comply or a refusal, your service provider will discuss meeting options, which could include canceling and rescheduling the meeting or conducting a virtual meeting.
If you or someone in your house is coughing and/or appears to have a temperature during the visit, our staff will need to modify or terminate and reschedule the visit. Oakland Family Services wants you to know that we are doing everything we can, following Centers for Disease Control and Prevention, U.S. Occupational Safety and Health Administration, and state guidelines and recommendations to keep you, your family, and our staff safe during these unprecedented times. Thank you for doing your part. We will do ours, and this will work if we work together.